The number of women giving birth by cesarean or C-section is on the rise. According to the Centers for Disease Control and Prevention, nearly 28% of American women gave birth by cesarean delivery in 2003. That's up from 23% in 1990. A C-section is major surgery with more risks than a vaginal delivery. In this month's cover story, Rod Starnes takes a look at when a C-section is necessary and what it means for a mother and child.
The baby's gonna go tick. Oh, you silly.
Planet Swan has given birth twice and has two beautiful girls to show for it. With her first child, she planned for a vaginal delivery, but ended up having a C-section.
That's the one thing I sort of learned about the whole birth plan thing. There's sort of no such thing. You kind of have to just go with the flow.
And that's what Planet had to do when she was ready to start pushing. Her OB-GYN, Dr. Susan Merman, decided that a C-section was the best route when she discovered that the baby was in an unusual position.
C-section is a way of surgically removing the baby from the mother's abdomen, basically. It's done for reasons of distress to the baby, which the baby looks like it's not doing well, or the mother might be having some problems.
For a mom-to-be, there are risks and benefits of a C-section.
The benefit would be that you're getting a healthy baby and a healthy mother. Risks, just kind of like you have surgery.
That includes the risks associated with anesthesia, plus bleeding, injury to the bowel or bladder, and infection.
Infection can be a risk of every surgical procedure, but it's especially higher when it comes to mothers in labor. If you're in labor for a long time, sometimes the vaginal bacteria can contaminate the wound, or the baby may be infected.
But like most other surgeries, cutting-edge advancements have made the C-section procedure much easier on moms.
A lot of times what women worry about is being able to get up the next day, take care of their baby, and the fear of the pain from the incision. But surgery and C-sections have come a long way in the last several years. Anesthesia is a lot better. The 24-hour coverage of anesthesia after the delivery is better than it used to be, even a year ago today. A lot of times infection rates are down because we have better ways of closing the wound.
The only frustration about that is when the baby comes out with the C-section, it wasn't like, oh, she lands on your chest and it's really quick, They kind of had to check her out first to make sure everything's okay, and I just wanted to see her so badly. But I was able to nurse right away. Like I told them that I wanted to nurse, and it didn't get in the way of that, which was great.
Then Planet was released from the hospital and went home to take care of her new baby.
There was a big healing period with the C-section. I was home and kind of had to get up and leaning over at all times, walking. I was just afraid to stand up straight. It was a long recovery.
For moms-to-be, giving birth by C-section can be a very different experience than giving birth vaginally.
You're such a sweetie.
Just ask Planet. With baby number 2, she wanted to try for a vaginal delivery again and was able to have her second baby this way.
It was interesting because a lot of the moms that I knew from my daughter's activities were saying, just schedule it, just go on in there and schedule it, just get it over with and done. But I just remember what a tough recovery that was.
So Planet talked with her doctor about the risks of having a vaginal delivery after having already had a C-section.
So after explaining all the risks to her that are, uterine rupture, and then I think it's also best when you've had a previous C-section to not try a natural childbirth, to go ahead and get the epidural in the event that you do have a uterine rupture. We're not scrambling around trying to get anesthesia. So she came in and we watched her very closely, and she had a very wonderful delivery.
And I was able to walk around, and I definitely felt like I was able to be more part of the household as soon as I got home, rather than the second time around. I was sort of bedridden for a couple days with the C-section, and in a lot more pain. I mean, it wasn't easy, but it was definitely a lot quicker, and that was nice because with a child 18 months older, I really didn't have time to have a long recovery process. And I remember how long it took to get back in shape with the first baby, so I kind of wanted to be ready to start exercising and get back into my life again, with the second one.
And while each of Planet's little girls came into this world differently, they're both part of a happy family.
The great thing is I have the two girls. They're both very healthy. They both came out, without any incidents, that everything just worked out. I mean, I'm having a blast with them.
For Smart Medicine, I'm Rod Starnes.
Joining me now is OB-GYN Dr. Henry Sullivan. Dr. Sullivan, thanks so much for joining us.
Thank you.
One of the other things that Dr. Merman had mentioned is a trend for first-time mothers to have elective C-sections. Tell us why that would be.
It's almost a cesarean section by demand, if you will. A patient might prefer to opt for an elective operative delivery by cesarean section as opposed to a vaginal birth. And we've seen so few of these patients currently, but it is a trend which seems to be moving across the country. The reasons for this would be to avoid any chance for vaginal trauma with delivery.
What are the dangers with this?
A cesarean section, remarkably, is a very safe procedure. However, it's an operative procedure. You still are having a surgical procedure where the risk is one of infection or potentially the need for a transfusion should you bleed, or an anesthetic complication that might lead to other morbid complications from the surgery. So it's a surgery. It needs to be kept in mind. This is a surgical procedure.
Is there a specific group of women that should really avoid this?
None that come to mind, with the exception of someone who might have a contraindication or a potential adverse event that might be secondary to any type of anesthesia they may receive. If they have a family history of anesthesia problems, or if there's a reason not to or try to avoid surgery in some women, those would be the women that I would say should opt for trying to have a vaginal birth if at all possible, or opting for that.
Is a C-section by demand covered by health insurance?
The few that we have tried to clear with insurance coverage has been met with a lot of difficulty. So there is, right now, it's difficult to get an elective cesarean section or a cesarean section on demand approved by the insurance carriers. It usually requires that we talk to their medical director and explain some of the reasons why this woman is choosing for a cesarean section to convince them that there is a real need there. When you talk to the patient more about it, many of them are very apprehensive, frankly, about having a vaginal birth. And so it's almost a phobic feeling of a vaginal birth. And the medical directors for the insurance carriers can appreciate that.
Dr. Sullivan, thanks so much for joining us.
Thank you.